Hello, it's Dr. Bettina here from Nip in the Bud. We've had a letter that says, my daughter is 10 and she has started getting stuck on scary thoughts that she can't stop thinking about, and she can't go to bed unless the washing machine has finished. How do I know if my child's habits are OCD or just a phase? OCD stands for Obsessive Compulsive Disorder. So there are two main symptoms: obsessions, which are unwanted thoughts or ideas that a person has that they don't want to have, but they cause a lot of anxiety. And then compulsions, which are behaviours that the person has to do in order to get rid of the obsessional thoughts. And these can become quite ritualistic or quite compulsive. The D bit, the OC, so the O obsessive, C compulsive, D for disorder, means that it impacts on daily life to a very significant degree, and the person can't resist doing the compulsions. Now, of all the mental health disorders, this one can be really problematic if it is left untreated. It's generally not something that will resolve by itself. So you do need to keep an eye on it. You need to think as a parent about what you should do and not do. So thank you so much for this letter. And I have got a few ideas that you can think about. As a general piece of advice, I would recommend talking to your kids about thoughts and feelings as part of everyday life. Now, I always say this, I know, but it's particularly important where there is OCD, as it is a thought-based disorder. So here's how it goes. The thought or the obsession for your daughter, it might be something like, if I go to sleep before the washing machine finishes, something bad will happen. That leads to the anxiety, the feeling, the big feeling inside your daughter that it's very hard to resist. And then the compulsion is the solution. So the solution is, I'll just stay up until the washing machine is finished. So kids usually don't know this unless we explain it to them. So explain it to her. I would really recommend actually doing some reading, watching videos like this. You are watching this video, but really understanding it yourself so that you can help your daughter to understand it. There are specific actions that parents can do that can help, and there are specific things that parents do that inadvertently can hinder a child in dealing with their OCD. So it's really important to understand what you're dealing with. We need to tailor the approach depending on how entrenched the difficulties are. So if you've just started noticing the behavior and it's an early stage presentation of these OCD symptoms, you would do something quite different to dealing with a child whose behaviors and OCD has been there for many months and years. And I'm going to separate those two things out and help you understand what to do at the different stages. If your daughter is in the early stages of OCD and you've just begun to notice the behavior, I would recommend, first of all, being curious about what she is thinking. Young people don't know that we have thoughts going through our head all the time. Some of them are worth listening to, and some of them are not worth listening to. And OCD and anxious thoughts are generally not worth listening to. They tell us that something terrible is going to happen when it isn't. So this may be news to your daughter. So have a conversation about that. And then when you're talking about her thoughts and trying to be curious about what thinking is going on for her specifically, use language that is what I would call metacognitive. It's thinking about thinking. So you would talk about the thought as if it was outside of her. You would say, what does the thought tell you is going to happen? Not what do you think is going to happen? You see, it's a subtle but very important difference. And in the early stages, don't make too big a deal about it, but also don't ignore it. I know that's a lot to ask, but it's a light touch intervention. So you might try something like saying, let's go off to sleep. The washing machine will finish soon. Now, if that is a problem and she begins to get very distressed, then I would let it go that evening, but know that you need a different approach and you need to deal with things in a slightly different way. We know it's a bigger problem than a passing phase when it's persistent, intensive, and it interferes with everyday life. So persistent meaning it happens every day, or it's been going on for a while, maybe months. It's intensive. That would mean if it's something like hand washing, it goes on for maybe more than an hour a day, where it's happening all the time with the example of the washing machine, or it interferes with everyday life. If it is stopping a young person from sleeping or taking part in school or seeing friends or anything, then that is concerning. It's also more than a passing phase when the distress level is very high. So if they have to complete the compulsion or they get very, very distressed. And the third thing to really think about is whether they can change it. Can they not do it? If they become highly rigid or they really can't be reasoned with, then you probably need a bigger intervention than what I talked about before. Just to say, there's a really important distinction between accommodation and support. So parents want to protect their kids. They obviously want them to feel okay, but sometimes they will accommodate where support is needed. Let me just explain those two things. Accommodation is where we change the environment in line with the anxiety. So we might allow a young person to stay up until the washing machine is finished. We might let a child wash their hands repeatedly in order to get rid of the germs as they see it in their mind. We might look under the bed for monsters. So those are accommodations. We're essentially going along with what the anxious or obsessive thoughts are telling the young person. It's tempting to do it. It gets the child to sleep. It allows us to move on with life, but it doesn't help the young person in the long run because the anxiety is in charge. Support, on the other hand, is where we validate what the child is feeling, which we always want to do, but we gradually, and at an appropriate time for them, help them to challenge the thought or stand up to the compulsion. Now, for a child whose problems are really entrenched, we need to look out for where we've been accommodating. And then we need to set up a program of intervention to reduce the compulsions and moving towards this support rather than accommodating. And that's where professional help may be needed. We know that there are treatments that really work for OCD. One of the best treatments is something called ERP, or exposure response prevention. It's a specific type of cognitive behavioral therapy. And there's a very good evidence base that when it's carried out properly alongside a therapist, it really helps individuals to extinguish these fears and these compulsive behaviors. But it's all about exposing yourself to the anxiety, essentially, and beginning to set up a gradual program of extinguishing the compulsion. Now, some young people actually do really need medication, and they would do that alongside this therapy, this cognitive behavioral therapy, or exposure response prevention. But it wouldn't be the first line of treatment. So really good luck with this situation. There are some really fantastic resources. We will put lots of those in the notes. Books that you can read, not only for yourself, but books that you can read with your young person. And I wish you really good luck. Of all the mental health struggles, OCD is really one that we do need to nip in the bud. It can make a big difference. So best of luck with things. And if anybody else has any questions for us at Nip in the Bud, please drop us a line and we will do our best to give you some tips and ideas.